And thanks so much for being able to join today to be able to talk about ongoing areas and issues that may come up as you're working with patients who use substances. Um, our last main talk was on cognitive behavioral therapy as one of the treatments that can help in substance use services. Today, we're going to talk about mindfulness-based treatments for substance use because we recognize that we need to find and work with each potential type of therapy to find the one that works best for the client. So some clients may do better with the more structured environment of cognitive-based therapy. Some people may need a little bit more free-flowing, like mindfulness. So we'd like to be able to offer whatever the client may find is best suited for helping them in their road to recovery. Uh, so we always want to provide you with multiple options. These slides were developed from a presentation by Dr. Witkovitz from University of New Mexico. So I want to acknowledge that. As an overview, we'll first talk about what's the theory behind mindfulness-based approaches and why do we feel that that's been helpful in the treatment of substance use disorders. Then we want to talk about the key practices, adaptations, and challenges that the different practices for mindfulness services may be helpful with for those who use alcohol or substances. And then we'll talk about implementing that practice in your clinical setting, working with clients. And then how do you then develop an intervention based on that? And even if you want to look at your outcomes, particularly in your clients' days that aren't days that our clients don't use, decreasing use, and also decreasing multiple substance use. Because now, these days, our clients may not only be using heroin or what may be in the heroin that they're purchasing. They may be also using stimulants, benzodiazepines, as well as alcohol or cannabis. So in being able to utilize mindfulness-based practices for multi-substance use will be really helpful in helping to improve outcomes for your clients. And kind of starting off with our joke for the day, we know that all of us know the things that we're trying to quit are not nearly as hard as staying quit. So quitting the first time gives us a little bit of a break of, hey, makes it feel like we've accomplished something. But staying quit is always problematic, especially when we may go to a restaurant and the waiter says, today's special is the New Year's resolution buster, a fatty steak smothered in French fries, marinated in hard liquor, stuffed with chocolate cake, and topped with a cigarette. Multiple things that we're trying to be able to manage and negotiate with good coping skills are tough to keep up in the long term. So finding ways that we can address that are really important. When we talk about the substance use relapse cycle, and this actually is very similar to the slide that we discussed when we talked about cognitive behavioral therapy, we know that there's that antecedent. Here we're calling it the trigger. Then there's the internal piece that happens cognitively, the discomfort or wanting the substance, wanting to seek relief from pain, or craving pleasure. And we talked about that pain and pleasure push for a substance, the craving of the substance, which is also a cognitive part, and then the actual behavior, which might be the subsequent use of a drug. Now, it may give us a temporary alleviation of pain, physical or emotional pain. It may give us some temporary high in terms of pleasure, but then we have that cycle then shame, guilt, the feeling that I'm a failure or that I relapsed, the feeling that, oh no, here we go again. I'm right back on that same merry-go-round, feeling hopelessness, feeling fear, which unfortunately then triggers additional discomfort and then wanting. So we see how that relapse cycle sadly continues to cycle into the initial trigger, the discomfort, the addictive behaviors, and then the shame and stigma that go with that then trigger their own continued use. What we want to look at doing as part of points of intervention are multiple areas that we can try to provide mindful activities to help intervene in this cycle. For trigger, we can work on raising the awareness of triggers and how to redirect them from entering that cycle. We can try to change the reaction to the trigger so it doesn't immediately become that discomfort or wanting or craving. We can raise awareness of what the discomfort is. How does it feel when you get triggered? And what types of things can you do to change that reaction to that feeling of discomfort? We can raise awareness of the cravings. Do you start to, like, when you're hungry and craving food, we have our stomach will start to grumble. We might start to have some mouth watering in our throat. Someone who's using substances will have, and we need to learn those similar cravings. And when we think about mindfulness, mindfulness puts us in touch with what is actually more physically happening with our bodies. And sadly, many of us don't do that on a regular daily basis. We're exercising, we overexercise. Our body tells us that our muscle has been pulled or stretched before it ends up getting strained or injured. But we don't always check that feeling and sensation in our system, in our body. Now, with mindfulness, you're actually kind of helping your client to be more alert to what's happening in their body. And then in terms of craving, being able to change that reaction to the craving when it comes so that we can raise awareness of use, change the reaction to decrease use, which then decreases the likelihood of falling into that guilt and failure cycle. So, what practicing mindfulness means is just being present in the moment, observing how you feel, observing what's happening in your mind, the actual thoughts that are coming to you in your mind, observing what the target of those thoughts are. Are they positive? Are they negative? Are they circling back into that cycle? And then paying attention to how that follows. And is our attention wandering? Many of us, especially now when we're so used to scrolling on our phones, we've been talking now just about 10 minutes, but our attention may also already have wandered to, oh, what do I have to, what's for dinner? Do I need to pick up my child from school? What time is this? Are those types of things are part of what may happen. So when we practice mindfulness, we want to focus on the here and now and pushing out the distractions of what may happen. And if your attention wanders 100 times, we bring it back 100 times because attention and focus is something that just like a muscle can improve with practice. We actually train and work with persons who have ADHD now to train to focus better and train to help with their concentration. So we know that these activities can help our minds to stay on task. So, what does mindfulness meditation actually mean? We know that it actually, with practice, and as we say, it's like practicing or going to the gym, meditation practice is associated with changes in your brain structure, your function, how it connects, connectivity. And that connectivity means it's connecting better. It's making more connections and more tight connections so that we notice increased attentional control, improved physical health and immune function, enhanced self awareness, and greater self regulation, because then you can regulate your thoughts and then regulate the emotional reactions to your thoughts so that things that may normally be a trigger or a craving, you can change that your body's and your mind's response to them and then the behavioral response to them. And it also seems to reduce perceived stress so that we're not as stressed out. And in these days, everything we can do to help with decreasing stress is an important thing that we can do. Mindfulness is particularly important for substance use services in addiction because, as I said earlier, many clients, when they're in a pattern of substance use, are not paying attention to their bodies. When we help them to focus on that, it gives them greater awareness of their triggers and responses so that they can interrupt previously automatic behavior, which frequently led to the substance use. We can keep clients in the present moment so that they can accept the present experience, even if it's somewhat uncomfortable, rather than feel like they need to get that fix to avoid either the present experience of pain, emotion, or the discomfort, or the push to feel pleasure. Keeping someone in that present moment and allowing them to focus and be okay there really helps to be able to reset that relapse cycle that we talked about. We also want to do this from a non-judgmental stand. We don't attribute any thoughts or attribute any behaviors to something negative about the person. Our thoughts are just what they are, thoughts, but they don't necessarily need to lead to behaviors. Just like we focused on in cognitive behavioral therapy, we can change our thoughts to change our emotions about the thoughts and to change our behaviors. This does it in a very similar way to decrease the likelihood that our thoughts and behaviors lead to relapse behaviors. There are a lot of studies that have been shown that mindfulness based therapies have been really helpful and very efficacious in helping to improve outcomes and extend recovery for persons who may be using substance. And this is just a few of the studies that was done by this team that developed this mindfulness based practice manual that we'll be going over. Mindfulness based relapse prevention actually is utilized with the mindfulness practice and those relapse prevention skills so that we have an activity that we can do at each point of that intervention process of the relapse cycle. The initial stress reduction part of mindfulness was developed in the late 1990s. The part of actually combining some of the cognitive therapy activities were more after 2000, but all of them were focusing on the present moment, how you're feeling, understanding your body, and being able to use that response and in that experience to make a different change and a different behavioral outcome other than a reuse of a substance. So it's generally provided in sessions for aftercare, after a rehabilitation hospital, or after someone is started on, say, a medication like methadone or Suboxone. So they don't have acute, immediate cravings or acute, immediate withdrawal. Because, of course, it's difficult for someone to try to focus on learning a new skill, activity, or practicing a new skill while they're in the throes of acute withdrawal or are not currently on medications for opioid use disorder, which could be part of their initial stabilization for treatment. It's a group format that's done in 8 weekly sessions. They're normally about 2 hours, but what we find sometimes is 90 minutes is sometimes the most even our attention as we're focusing on improving our attention can manage. But since we have many activities and interactional activities, which is part of what I'll include today, you can see that the 90 minutes actually stretches out longer because the activities and then debriefing after the activities take some time. And then after that is the daily home practice, so that people try to practice those learned activities from each group and then come back the next week and have a bit of a debrief before the session starts. And part of that 2 hours of, okay, what did we learn last week? How were you able to apply it? What were the results? So mindfulness-based services actually are based on this book called the Mindfulness-Based Relapse Prevention for Addictive Behaviors Guide. I actually have a copy of this book that I'll be able to post to you guys so that you can have the actual manual, the worksheets, and the step-by-step instructions so that when clients take this class, you'll actually have what we started as a discussion and be able to move forward right away and incorporating this with your clients. So I was able to actually find this link and find the activities with it because it was the class that I took when I was in school and the book that we used, although it's been updated since I was in school because every 5 years they have to update the book, so you have to go and buy a new book. But the same activities and PDF slides and the activities and handouts are what was part of that. So the components of mindfulness-based relapse prevention include the formal practice of relearning breathing and walking medication, learning how to scan your body. Many people notice you might say, oh, I've got a headache or I've got an upset stomach, but do we truly scan our bodies from tip to toe to see what's happening? And persons who may be using substances rarely do that because there may be some points or areas of discomfort and when we refocus and re-engage with understanding your body better, you can really make a notable difference. It includes mountain meditation and loving kindness, how to help to provide care and kindness to yourself. And many of us always struggle with our own self-care. So this is a great learning activity for this. Then there's the informal practice of how do you incorporate mindfulness into your daily life? Because if we have that practice of a session, people need to know, how do they actually make this happen for real? There's also sober breathing space so that we can practice the activities to help us. Particularly, this is helpful regarding triggers. And then urge surfing was where we feel that uncomfort, but also be able to move past it. And then we learned relapse prevention coping skills training, which we did as a training, I believe, in February. So take a look at that Zoom link that that you should have, Gloria, when we did relapse prevention, and that'll go over some of those coping skills as well. So we've actually had several randomized clinical trials that show mindfulness-based relapse prevention actually has had as good or sometimes better results than just strictly cognitive behavioral skills training, and both have shown to be better than just treatment as usual, which includes psychoeducation, relapse prevention, or 12-step groups. Because we really focus in the present and focus on how do I incorporate these activities into my daily life, part of what people may notice is it helps them to actually use this so that it makes it useful and serviceable for them. One of the comments from the clinical trials was when in the qualitative study, they asked, what's the difference between this mindful stuff and normal treatment? The resident response, we're all missing something in our souls, and we tried filling that missing place up with a bunch of drugs, but it didn't work. But mindfulness and this mindfulness-based relapse prevention actually helped me look at that empty place for the first time. And mindfulness-based relapse prevention gave me the tools to do that, and then the tools to figure out how I could fill up the missing place just by taking care of myself. And interestingly enough, I actually thought about that when I was reviewing this for this presentation. And for those of you who are religious, there's actually a parable that Jesus gave that's very similar to this filling up that empty space. And I'll read it and then we can chat about that a second if you have any thoughts. And this is from the King James Version of Matthew. And it said, after he had removed an unclean spirit out of a man, the spirit walked around looking for rest and couldn't find any place. And then the spirit said, I'll return into my house from where I came. And when he was come, he went to go see this man, and he found that it was empty, swept, and clean. And then he said, hey, he went and took to himself 7 more spirits, more wicked than himself. And they entered there and they dwelled there, so that the last state of the man that was healed was worse than the first state of the man that was healed. And what that actually means is, when you think about it, is and God cleaned that spirit, but nothing was replaced. And so it was a nice clean area, swept out, but there was nothing there. If we don't replace something, things can come back potentially that are worse. And I've actually heard a sermon activity to go along with that say, if we don't put in the good information and put in positive tools that can be used, we may end up using tools that are worse. I don't know if any of you may have a religious affiliation, but had you heard of that parable before?
I've heard of it before, yes.
Yeah. And so when I saw that person's response and looked at that, it helped me look at the empty place for the first time. That's kind of what clued me in. And then now that we have tools, we can put tools to use that are helpful and that aren't negative. And to me, that's a positive way to not only incorporate something that we say, sometimes the AA or the big book seems, some folks may say that's very religious based, but it's interesting that this as a clinical base was also available and really made sense and kind of followed in a similar line. So what are the targeted ways that mindfulness-based recovery work to help? The first thing is it really helps to address someone when they're having a high-risk situation that might lead to relapse, because it trains them on their lack of awareness of what their triggers might be, so that they don't automatically work on autopilot and just follow a trained behavior or a habit that they may have. And it prevents them from getting judgmental and self critical. And sadly, our own self critical thoughts, our own negative thoughts about ourselves frequently push those relapse cycles in a negative direction. It also helps to address with the phase of craving and the negative emotions that we may have with craving and the negative ways that we may react to stress. And you may hear some statements where, okay, somebody is more reactive than proactive. That means they may not take this first step, but when we react, we frequently react in ways that are even worse than what the trigger might be. And those may frequently lead to relapse. And all of those are part of working to decrease the likelihood of substance use. And the way that we intervene is utilizing those mindfulness based training skills, increasing awareness, decreasing yourself on autopilot, which happens when we're not present. Case in point, who's driven home from work after a hard day at work? And while you're steady driving, you said, oh, I'm going to stop at the store on the way home and pick up something. And all of a sudden, just as you pass the exit to go to the store, you realize, oh, I was supposed to turn off here. Raise your hand if that's happened to you. I'll be honest. Okay, yes, everybody. That's because our brain was on autopilot. Now, I don't want to scare you because you say, oh, wait a minute, I was driving my car and my brain was on autopilot. It can happen just that quickly and easily. So we want to decrease those autopilot steps because that's how someone in a relapse cycle immediately may, oh, this happens, I have this trigger, boom, and I'm at the point of potentially using. And we want to decrease judgment there. We want to increase self-kindness and appreciation for themselves and their own compassion and help them to be more proactive than reactive. In studies that we've done just in the last several years, we noticed that treatment as usual, rehab and AA, shows less improvement than actually mindfulness-based relapse prevention. And so that from the start of getting out of treatment, if someone just went through the AA and Big Book, they had actually higher cravings for alcohol than if they actually did the mindfulness-based practice at the end of 4 months. Similarly, in terms of depression, persons who actually had taken the mindfulness-based relapse prevention had lower scores of depression than those who had treatment as usual, AA or the Big Book activities. So studies that we've shown actually showed that utilizing and having these additional skills really made a difference. So let's go over the format. As a quick reminder, we know that there are 8 weekly sessions, and we follow up just with those sessions and the daily home practice that we have as well. The components are the formal practice that you do in sessions, training on the informal practice, and coping strategies to deal with stress. We're focusing on the body's awareness of their thoughts and feelings, responding versus reacting. Once again, the proacting versus reacting, feeling comfortable with discomfort so that we learn how to be with rather than I'm fighting this, I'm avoiding that, or I'm trying to fix that emotion or that discomfort level. We also look at that self-acceptance and compassion and focusing on a good lifestyle balance so that their lifestyle is aligned with recovery. The approach to it is experiential. So we talk about our experiences, our day-to-day activities, the things that we do from day to day to help us. The present moment versus a story from the past, and making sure that as the facilitator, we talk about the non-judgmental method, an openness to discuss, and a curiosity in everybody's experience. And we want to elicit and ask versus teach. So I know I've been doing a little bit of teaching, so I'm going to get to an activity real soon so that we can discuss how all of us learn collectively together versus a didactic where there's just a teacher and then pupils sitting. So part of the work that we want to do is help remove those negatives. I can't do this. What's wrong with me? Or I need a drink, to experiencing what that experience is right now in the moment, not a story from the past, are those thoughts or judgments. Well, why can't I do this? Well, because I'm feeling sad. Okay, so what can I do instead of a story? Well, the last time I felt sad, I went and had a drink. The last time my automatic thing was to go and gamble. Any type of activity that's related to addiction can fit right there. And then we want to relate that to, so what can I do instead of part of that relationship to relapse? So it's not a personal issue or a judgment issue, it's a human experience, and we want to experience it and then work towards change in the positive. So here's our first practice exercise. Let's do a practice on sobering and finding that sobering breathing space. Part of that includes stopping what we're doing, observing. We want to deep breathe, expand our thoughts, and then we're going to respond and talk about it. So for the first thing, I'm going to ask you guys to go in your home and find something in your house that has chocolate in it. Does everybody in your house have something with chocolate in it? Nod or thumbs up if you can think of something that has chocolate. Okay, Daniel, you're nodding. Okay, so we're gonna give you about 2 minutes. Kamara, you're nodding. We'll give you about 2 minutes to go and find something in your house that has chocolate in it. Come back and just show it to me. All right, Gloria, you have yours. Oh, yes, chocolate chip cookie. All right, and Daniel, what did you find?
I'm at the office, so I got some chocolate chip granola bar.
Oh, cool. And I had I'm trying to work on my weight, so I had one of my diet chocolate bars. Now, generally, when we do this in a group, we usually use the same thing. So we used to tell everybody to hand out raisins. I personally don't care for raisins, so it was never like the best activity for me. So I switched over to chocolate. And the reason that I actually have folks, especially since we've been doing it since COVID, is I have people go and get what they have at home for chocolate because it's always something slightly different. And I think the important thing to remember, even if every one of us were tasting the same exact thing, our experiences would be slightly different because everybody's experience is different. But I think it's sometimes easier to see that when people might be eating or experiencing different things. So the first thing I'm going to ask you to do is take a piece of whatever it is that we're going to have for chocolate and take a small amount into your mouth. Take a nice bite. All right. And now I want you to stop what you're doing. Put everything else down and just listen to my voice. You can close your eyes if you want to. Stop what you're doing as you're starting to feel the chocolate just on your tongue. Don't chew it. Don't start to chew yet. Just feel it on your tongue. And you can move it around with your tongue to start to observe. Observe how it feels. Is it soft or can you feel it slowly dissolving in a swirl? Does it have some graininess because it has uh, the other part of the non-chocolate chip part of the cookie? Does it have granola so you can feel the oatmeal as you're swirling it with your tongue? You know, oatmeal has that little line between each one oatmeal press. So you can feel the different graininess, the softness. You can tell what the difference between the oatmeal and what part is the flour from the cookie. And as you're doing that, you want to slowly breathe in for a count of 4, hold it, 2, 3, 4, and then out for a count of 4, and then hold it, 2, 3, 4. If you've accidentally gone ahead and chewed and swallowed, it's okay to take another breath because I really want you to feel how unique what you're tasting is on your tongue. Expand your mind now and think about the different molecules of chocolate that are on your tongue, the different molecules of what might be the bread, or what might be oatmeal, or for the chewy bar, maybe a little piece of the raisin. And hopefully you like raisins. But think about all of the different molecules, as there are now thousands of molecules in your mouth of chocolate, of bread, or the dough, of oatmeal. And as you slowly just swirl that around in your mouth, you can feel it getting slighter and slighter on your tongue, and even kind of spreading across the whole of your tongue so that its effect, or that initial sharp chocolate bite, is a little less and a little less. And then when you're ready, you can go ahead and swallow that bite of chocolate. And then we'll talk about how that was. So you've stopped during this whole time. You've truly observed what it was to taste that piece of chocolate. You breathed and relaxed as it slowly has dissolved on across your tongue. You've expanded your mind to think about the actual experience of your eating that one piece of chocolate. And so now when you're ready, after you swallow that, you can open up your eyes and tell me how that experience was for you.
Well, if it's just about the food, because I started to, I can taste like all of the flavors. I'm like,
Mm-hmm.
oh, there's vanilla.
There's vanilla, yes.
So that was interesting.
Mm-hmm.
I'm like, I feel like I can taste all of the ingredients now in this cookie.
Yes.
And
Yeah, I forgot. I
I never
usually
got it.
mention.
I'm
Yeah,
sorry.
thanks for saying that. No, I forget to mention sometimes the vanilla extract. Yeah.
Mhm.
And Daniel, what did you notice as you were as part of your response?
Yeah, like with the chocolate, it was just feel the texture, sugary drops. And that's
Mm-hmm.
easier. The texture difference with the oatmeal, just mentioning like the richness, giving that texture, what it feels like, what it could be like. And I do like going into just the what is it, the biology of how those things are made. But no, it was just interesting doing being present in what I'm actually eating, processing, looking at.
Mhm.
Yeah, it was.
Exactly. Or even sometimes you can taste what feels like a nut. Oh, that's a peanut. That's a peanut in there.
Mhm.
Yeah. That was one bite of your food. Now think about the last time you ate whatever that was that you just had. A chocolate bar, a chocolate cookie. How quickly did we gobble those up likely? Think about it. Mm. It's okay to say. Mm.
Yeah,
And I noticed mine because I grabbed this one because it has the little crisps. It's like I guess the equivalent of the Nestle's Crunch Bar,
yeah.
but not so many calories. And I noticed when I did it, not only did you feel the little crispiness piece, but
Mhm.
you also felt a little bit of the dough that apparently those crisps are wrapped in dough. And I didn't even know that.
Mm.
Those little crisps have a little bit of dough surrounding it. And if you
Mhm.
just really leave it slowly on your tongue, the crisp kind of starts to dissolve, but then you can feel a little taste of dough. And think about, truly enough, if we kept aware of all of those types of activities and experiences during the day, when we literally just took about 3 minutes to go over just that, if we can focus on the present, we are or hopefully we didn't get too many intrusive thoughts about when this is over because I got to do some paperwork, I need to sign a chart, all of those things that kind of bombard us, but we keep us from really focusing. I get such good responses when clients do this because they feel like they rush through so much. And truly enough, don't we all? But when we really can help with having folks to feel present in their activities, it really can make a difference. I know we're going to have some discussion questions, so I'm going to go through these next ones a little bit. So the sessions are broken down into 8 sessions, and it focuses on the sections that we talked about earlier. The first is increasing awareness. That automatic pilot this is one of the first activities we always do in the automatic pilot. And it shows us, one, we'll give that example of driving home and missing the exit. Okay. And then we'll talk, and that second, we'll also have folks do that taste test where we really start to focus them on doing that sober. And that sober activity, remember with the words, stop, observe, breathe, expand your mind to the activity, and then respond. Because you want to train someone first on that so they can always have that initial coping skill of the thing that they can do it instead. Does that make sense? So that's the first formal activity that you're going to give them. Anytime you feel a rise, what's happening? The next, you have to be aware of your triggers. Many people, that take a while for them to even back up in what was happening before then. What was happening before that? Well, I used, okay, and then tell me about the day. And you have to really help them break down what was the initial trigger. Once they know that, you can even then start incorporating the sober. Okay, wait, I'm going to take something, or even have them, if there's something that, well, I'm going to carry a chocolate bar with me. That's an immediate step that they can do to stop and have them doing a mindfulness-based activity. I'm going to go through and completely eat my chocolate bar, use my sober, observe, expand. Okay, do I even still have that craving anymore? Some clients have said just doing that will help them to ground themselves and focus so that the craving actually settles away. The next thing you do is the practice. What are those skills that you can use in those high-risk situations that may lead to relapse? Mindfulness during that time, some activities that you can use during that time, how to self-accept and use that self-acceptance as a skill, because we know that triggering of shame, self-deprecation, feeling helpless and powerless, and then kind of beating yourself up. And that's not listed on that slide, but I have so many clients tell me they beat themselves up before they even use. They beat themselves up before they relapse. And then they beat themselves up after. I said, well, wait a minute. So the punishment was coming before and after? And then they said, yeah, I was punishing myself and I hadn't even done anything yet. And so you were creating an additional level of emotional pain that you then felt you had to alleviate by using. And it was like, wow, because they were still in that slide of that relapse cycle. So this really can be helpful to help clients see their own thoughts. Well, that's just a thought. You hadn't even done anything yet. You just thought about using. You hadn't used. Oh, well, I was calling myself stupid and I hadn't even, just because I had the thought to use. It really helps clients to be able to reframe. And then finally, as part of the self-care, what do you do in daily maintenance? How do you incorporate this into a way that it really can make a difference for folks? And that's where you really see the rubber to the road. Okay, how is this being practiced? How do I do this in regular life? You have clients coming back and saying, oh, this happened and I was able to use this or that, or I even tailored it a little more so that I could kind of do it on the fly. I was on the CTA, and now I just chew a candy. I just chew my candy on the CTA so I don't stop at that Pulaski exit, so I don't go and buy something. I keep myself in the present. I'm heading home and I'm just chewing my chocolate bar and I'm staying in the present and I don't even think about stopping on the way. And that was actually such an improvement when the person would usually stop on Pulaski, buy some drugs, get back on the CTA and head home. The formal practices include helping to learn how to do a body scan. And in the manual that I'll send you, it actually talks through how you can train someone to do that. I actually also encourage people to go to their YouTube if they have YouTube on their phone. And there's several great mindfulness body scans that they can listen to, because sometimes it's hard for them to learn those initial steps, or they may get frustrated in the process. Because remember, our clients typically have low frustration tolerance and they're like, oh, I'm going to quit that. So you want to give them some real easy steps that they can already start. And so I usually I can send you some links, but I literally just type mindfulness body scan on YouTube and it comes up with several in multiple languages. So if you work with clients that are Spanish speaking, here we've had a couple of clients that speak Mandarin. All of that is available free on YouTube. The mountain meditation that sees them slowly calming and relaxed as they actually climb a mountain. And what they don't know is you're going to less after that go in and put that and label that mountain a relapse. And you're going to help them know how to climb over and prevent a relapse from occurring by using their skills. And if you think about this, when we talked about the CBT, we did what are the 5 things you can do to help with cope. And the 5th one was like calling the 988 number or talking. So you start with the lighter coping skill, and then you work to more powerful coping skills. That mountain meditation, you start with the lighter coping skill and you work to the most powerful to get over the relapse. And if the most powerful is calling your sponsor or calling 988 to say, okay, and getting over that hurdle. Are calling now, some of the recovery cafes are open later at night because we know, 9 to 11 o'clock can sometimes be a triggering hours for folks. That might normally be the time they're drinking themselves to sleep or getting off from their 7 to 7 shift and looking for a substance. A lot of the recovery cafes are now having late nights so that they can be available, particularly on Fridays, payday Friday, to be available for that. The other is loving kindness meditation. Meditation. So we may need medication, but meditation is good too. But for the loving kindness meditation to help focus on that self-care and get rid of those negative self-thoughts. Informal practices include helping someone do a physical activity called urge surfing. We're going to practice that in just a second. Mindfulness of their daily activities. So even if they're doing something as routine as sweeping the floor, how does it feel when the broom hits the floor? If you have a real old broom that actually has straw, what does that straw? You can kind of feel it almost like that little grittiness of the broom, the little bristles hitting the floor. What does that feel when it bumps up against something that you're brushing? I thought of activities to help focus right there on their current present status, as well as the sober breathing space and a mindful moment where you're literally just teaching someone to count through a count of 60 and doing their deep breathing and focusing on what they're hearing, what they're seeing, the taste senses, what they're tasting, what they're hearing, what they're touching. So you're helping them to ground themselves. Just to mindful of some of those activity intentions for mindfulness-based training, their awareness, the daily decisions that they make that might increase their risk. For that client that I was mentioning earlier, just taking the Blue Line CTA increases that trigger risk because they normally got off on Pulaski and made a substance purchase. So you can even discussions on setting your GPA or setting your directions to say, oh, the green line can take me around to that same location. I don't even have to get on the blue line where I might be triggered. All of those can work to help you with decreasing risk and awareness. What are your internal triggers? Is payday an internal trigger? Is having an argument with your mom an internal trigger? Yes, Daniel.
So, just wanted to know in your experience, I know lately because I take public transportation,
Hmm.
it's smoking, cigarettes, crystal, it happens. People drinking, people everything. I just wanted to know when the mindfulness of redirecting somebody so they're not tripped to get off at a stop is one thing, but in your experience, have you had any clients or folks who have just had that trouble of simply riding on public transit because of what's going on? And if so, what kind of guidance would you give those folks since public transportation may be their only means?
That's a great question. And sadly, there's so many things in our regular daily activities that can be triggering. We do have to kind of find what works for us. That one client where they actually just brought something to snack on, and so used that sober consumption of that chocolate bar, and they also listened to music. They also listen to for for them they listen to like the old because it reminded them of their family members that were older. So they listen to like the old school music like Earth, Wind and Fire and movie music from the 70s and 80s. And sadly it's gonna date me because now that's real old school. Old school is 90s and 20s and 2000s. But for them that was listening to their older school music. And think about it, our clients that are at risk are in that age group. There are for their 40s and 50s, the ones that I'm working with, the majority in trying to help with that, although sadly we're getting more and more youth. But the majority of folks that I may work with for activities like this are in their 40s and 50s. And so what was a time, what's a music that calls you back to a positive time? And that's one that I frequently use because a lot of clients before that time realized that they weren't using substances back then. So they may pick a time. What's a good time in your life for you? What was happening then? What music were you listening to back then? What things were you doing for fun back then? Because we don't always think about it, but there truly is a before first substance consumption and an after first substance consumption. For some clients, their lives may likely frequently change because when we ask, you may ask in part of your assessment, well, what do you do for fun? What hobbies do you have? I don't have any hobbies. And when you hear about their lives, they feel sadly small because they may not have a good social set except for others that are using. They may have burned some of the family, so there's only the ride or dies that are still there alongside of them. So you really can ask them as part of their recovery journey to start to look for what were you wanting to do before? What was fun for you before? Oh, I used to crochet. Or I used to do so and so. I used to play 3-on-3. Hey, basketball, hey, let's get some of those going because then you can kind of find something that brings them back to a time in their life that doesn't potentially cause those triggers and environmental triggers. But kind of going back to your question about the bus, it's finding what works. I've had some clients that sadly felt that they just couldn't use the bus. They had to do an Uber. And in that way, Uber kind of takes the potential to jump out of the situation because the Uber can only take them to where they signed up to go. They can't really, unless they cancel the Uber and reset, the Uber isn't going to make a stop along Pulaski. So I hope that kind of answers your questions, but it is a tough one. It's finding, and part of that is when you do let me go back to when you do that awareness of the triggers and craving, you're going to actually have them create and write what are some of those things. That's when you'll be talking about what are some of the things in your life that were pre-use that were positive. What were some of the music you enjoyed? What did you like to do for fun? And you'll find out people used to journal, they were artists, all those types of things. And that's what you'll then incorporate some of these activities. That help to give you some ideas? That is a tough one, but you can walk through a client's day with them. And I frequently will ask, even as part of my assessment, I'll do so take me through your day. and ask what time they're waking up, then what are they doing next, then what are they doing next, what is their anxiety level during the morning, early afternoon, evening, and a couple of hours before bed. And that way we can find times where triggers might start to increase. Like for a lot of folks, they do okay during the day. It's after dinner, because after dinner is when I would start drinking. After dinner is when I would start, particularly with alcohol. I'd go and have a cigarette after dinner, and then I'd start drinking and watching TV. So I have to create, okay, so what can you now do instead that is filling up that empty space? Remember, we talked about that. If we keep it empty and don't fill it up, it can then fill back up with, unfortunately, negative things. So what are we going to do instead that you can find emotionally gratifying for you and self-affirming? And that's why I frequently use the things that were of enjoyment for you before. And that helps and that's part of that recognizing and disengaging from those triggers and cravings. What were the after dinner? I get that itch to want to go. And for smoking is a little bit better, because I'll even have folks get, if they smoked a little bit more like a cigar or something, let them get a thicker pen, because then you have that feeling of the cigar in your fingers. And this causes, we've actually studied this, people who smoke, when they start rolling a pencil shaped item in their fingers, it causes a synaptic dopamine sensation. You know, like Pavlov and the dog, it causes one of those dopamine sensations in the brain. So somebody who was used to smoking a cigar, let them get a thicker pen, or like those big Sharpies, so they can roll that, because that actually triggers that dopamine in a positive way, but they're not smoking. And then what can you do instead of smoking? That's a really good example for that. I was looking for a pen, but I saw this big one, so I used that as a substitute. But what you're finding is ways for them to disengage from the triggering craving to the behavior of the substance use. Okay. Now let's practice a little bit of urge surfing. So picture this urge, or your urge to use, as an ocean wave, because that's how it comes. What we notice is people can tell exactly when their urges or cravings to use happen. First thing in the morning, right after they get off work, or in the evening. And so just for a minute, because I want to make sure we have time for questions, let's picture that urge to use, that craving, as an ocean wave. And imagine yourself surfing, just using your breathing, that breathing in for 4 counts, holding it for 4 counts, breathing out as you smooth down the wave for 4 counts. And then breathing in as the wave may be coming up, holding it for 4 counts, and breathing out for 4 counts. And I actually add something to the general box breathing. We're going to breathe in for 4 counts. As we hold it, I can control this. We breathe out for 4 counts. I can do this. That's so empowering when you can incorporate that. Breathing in for 4 counts. I can control this. And breathing out for 4 counts. I can do this. I've had some clients change the 4 words, but almost everybody loves that I can control this, because it's the powerlessness, their self-doubt, their own feelings of weakness, and sadly, their shame and stigma that makes them feel that the drug controls them. When they know they can control this, you've referred them for Suboxone, so the craving wave is there. And then I'm literally riding this wave, but I'm not letting it ride me. And you see how we're flipping that? Because clients will tell you the drug runs their life. No, now we're helping them literally surf on the urge and craving to use. And clients really find this one really very positive. We're helping that self-acceptance, shifting from emotional avoidance of talking about substances or talking about cravings to say, hey, I can talk about this. I can talk about the discomfort of this and be okay. As you talk to clients, you'll hear them say, when I start to get that urge, I'll get edgy, I'll get nervous or shaky. Okay, how do I sit in that discomfort and manage that with my breathing, with my staying with it? I'm feeling this, I'm not fighting, or I'm feeling this and I'm moving past it. That's why that urge to surf is really helpful. And it helps them to get to that basic need of what may be underlying that craving, because it's usually an emotional feeling of abandonment, of insecurity, guilt, or grief, and sometimes a combination of all. For kids that have maybe have been neglected or had abuse issues growing up, or ACEs growing up, abandonment might be it. Sometimes it's loneliness. I'm alone and no one's there to help me. And even being together in when using gave me a social feel. So you need to get to that basic craving or that basic need under the craving. And so you have them talk about what's that direct experience of that feeling of discomfort, and what are the things that I've learned in terms of breathing, surfing, activities, coloring, arts, all of those things that they did before that were helpful for them, that can help them go through and pass through that direct experience when they feel discomfort. With no judgment, no worry, and no telling it in the story in the past, what's happening right now in the present. Because that's when you can really help them find their own self-compassion. Rather than think about the past or their triggers from the past, know what's happening right now. So you reduce their contact with past triggers or how their behaviors may have been in the past that were self-defeating and depleting, to focus on what can I do right now with their natural supports, their reinforcements, their social support, even if that might be working with their provider to say, hey, I might get this anxiety. What can I do to help? And then, well, the first thing might be your breathing, listening to music, going for a jog or physical activity. Remember, physical activities trigger natural endorphins. Natural endorphins are opioids. Those are things that our brain makes to help control emotional pain. So that's a really great way. Oh, I can get a free boost by exercise or activities. A lot of times guys like to do boxing or the quick jump roping because they feel they can do something fast, and then it may frequently help with calming them down and causing that stir of dopamine as a wave. And they're like, that's a free high you don't have to pay for. And then it reduces self-judgment and increases their ability to know that I can control this, which is why I teach that as part of the breathing. Just a few more things to review. Just realizing that going through and addressing that area of pain, that direct experience that they're having right now, is actually actively, proactively coping, not suffering or reacting, but that they're learning how to proact in the present to address what's happening right now with them. Not telling a story of the past, or normally this may happen. Well, that sounds like in the past. What's happening right now? And as you're talking with a client in therapy, you may have to redirect them when you hear them use past tense versus right now and focusing around right now. And so that you get them to move from with that direct experience, which might be pain or restlessness, or that little kind of urge or edginess that folks get before they use, and help redirect. Oh, I can't do this. I just need to go. No, tell me how you feel right now. And what are the things that we can do? We did our breathing. We did the surfing. We surfed over that feeling of edginess that you had while we were talking about this. What did you notice during that exercise? And that was part of that response that I had you do when you guys ate the chocolate. What did you notice? What was familiar? What was different? How did that relate to when you're craving, when you may have had a relapse, or in times that you notice that you're in recovery? Because clients may not have that direct connection to their being able to employ something outside of using that helps to decrease that anxiety, that edginess, and that feeling of helplessness that may lead to a craving. So finally, once again, these are I'm going to post this book in the email to you guys so everyone can have this book with the activities, the handouts for each session as a resource. And we thank the folks at NIH that helped with writing this book. Okay. And then as always, guys, when you want to reach out with us, reach out for us for something, we're always available. If there are activities that you have, we want to be able to be responsive to that. And you can reach us at Rush's Substance Use Disorder Center of Excellence. Do you have any questions about anything?
We just want to say thank you, Dr. Sorrell. This was good. Wonderful as always.